Good afternoon, everyone. Okay, let's see if I can get this clicker to work. So it's really hard to follow all of the wonderful speakers that have already given presentations today. So I'm going to do my best. To my advantage, you'll hear less of me and more of our patient voice this afternoon. My name is Tennille Bruce, and I will be giving you an overview of one of the aims of our Safer Childbirth Cities project at Baltimore Healthy Start. So I serve as the maternal health coordinator at Baltimore Healthy Start, and it doesn't end there. I wear several different hats, such as the nature of the type of work that we do here in the room. And this is just a brief overview of our Merck for Mothers Safer Childbirth Cities project. The initiative as a whole aimed to support community-based leaders in US cities with a high burden of maternal mortality and morbidity to implement evidence-based interventions and innovative approaches to reverse the country's maternal health trends. So we were fortunate to partner with the Preeclampsia Foundation with this portion of the work. And our main contact was the Director of Education and Engagement, Rebecca Britt. So a more drawn out background of our project. So Baltimore Healthy Start received the Merck for Mothers Safer Childbirth Cities grant in September of 2019, and we were able to wrap activities within the 3-year span. So ending things in September of 2022. We endeavored to address and improve maternal health outcomes through 5 major project aims. And you can see them listed down below. They covered the areas of citywide surveillance, quality improvement, direct service, and sustainability. Many of those areas were covered today. So first and foremost, augmenting the state of Maryland's maternal mortality review process with the Baltimore-focused severe maternal morbidity review process, which we have been successful in doing with the launching of the MMRC through the Baltimore City Health Department. Implementing a Patients as Partners initiative to bring the knowledge and experience of maternity patients to bear on hospital and health system quality improvement processes, which we will be discussing a little bit more later. Implementing a maternal health monitoring intervention of prenatal and postpartum home-based assessments for Healthy Start clients with immediate medical referral if indicated. And Marilyn spoke beautifully about dyad care. So provide postpartum care services delivered by certified registered nurse practitioners, co-located and co-scheduled in FQHC pediatric clinics at 2 and 4 week, 2-month, 4-month, 6-month, and 12-month infant well child visits. And of course, seeking funding to develop and support other evidence-based maternal health direct services and patient-centered maternal health research initiatives. So regarding Patients as Partners, it was our effort to learn from women who had recently given birth, and we wanted to learn more specifically about their experiences and interactions with the healthcare system. And we were doing this in order to improve the quality of maternity care in the city of Baltimore. So some of the highlights of the program included focus groups to understand the experience of birthing women at Baltimore City hospitals, patient advocacy training of focus group participants, and patient forums where patients shared their stories in real time with hospitals in an effort to work as partners to improve quality. And all of this being done at the height of the pandemic, y'all. So many pivots were made in order to not only meet participants where they were, but to also glean very valuable information from their birthing experiences. The purpose of Patients as Partners is to understand the birth experiences of women in the city of Baltimore in an effort to improve outcomes in maternal and newborn care. Some of the methods of Patients as Partners included hosting 3 virtual focus groups in year 1, summer of 2020, and another set of 3 virtual focus groups in year 2, spring of 2021. Attendance ranged anywhere from 5 to 8 people. In a good group, we would get 10 plus, but the average about 5 to 8. Focus groups recorded happened via Zoom video conferencing software and were transcribed via transcription service. And the findings and recommendations in reports that have been given were informed by themes and direct quotes from the transcriptions. Just to give you an idea of the focus group participants, there were 34 women who made up the 7 virtual groups conducted. All of these women gave birth within the last 2 years at a Baltimore City hospital, reported at least one complication either during labor and delivery or shortly after birth. And also there were recruiting efforts made to select participants from diverse geographic locations within the city of Baltimore. So this was the flyer that was used for recruitment. Some of you may have seen it on our social media platforms or even in physical form. So we promoted through social media and also community partners in the Baltimore area. That would lead participants to perform an online screening survey. From there, we would contact participants that were eligible to participate in the focus groups, and instructions were sent via email. So it was a combination of me flooding folks' inboxes, texting, calling them directly on the phone, anything to get folks to engage. And participants were offered $50 incentives for completing the entire 2-hour focus group, because we all know that incentives get us results. So now I have the extreme pleasure of bringing SherWanda Knight to the stage. She is a patient advocate, certified patient family partner, most importantly, a mother of 3 and a survivor of preeclampsia. And we're going to hear more about her story. SherWanda? This is our first time meeting in person. Everything else has been through computer screens, so we have to have our moment. Can we get 2 chairs up here? And the 2 microphones that were used for Q&A, that would be great too. All right, and we're back live. So, SherWanda, we have spent this entire day hearing from doctors of all forms, nurses, researchers, and providers. And we now have the opportunity to hear directly from a patient, someone who actually experienced a lot of the things that were discussed today.
Yes.
So if you could give our audience an idea of who you are and what your birthing experiences were in the city of Baltimore.
So I am a mother of 3, well, surviving 3. As a teenager, I had pain, a lot of pain as a teenager. And I was going from doctor to doctor and no help. One doctor told me that it was all in my head and I needed to see a psychiatrist. So as time go on, we're gonna go to my first living child. Because before my first living child, I had 5 miscarriages, five miscarriages and 2 stillborns before her. No one explained why. Um, and as you can see, she's back there. The 14-year-old, she's back there. That's my first living back there. So during my birth with her, um, towards the end of my birth, well, during my they were trying to figure out why. So they diagnosed me with mother. I don't have mother. They said I have, it was the abbreviation of mother. I don't have it. They told me that I had thyroid issues. I don't have that either. Um, but towards the end, I ended up developing preeclampsia. Again, no one explained what preeclampsia was. They just told me my blood pressure was elevated. No one explained to me that after having her, I will continue to have it. Okay, time goes on. I have my second child, which is my son. He's not here, y'all. He can't be here with us. So during the time of birth with him, I developed preeclampsia straight in the beginning. Um, Again, no one explained what preeclampsia was. No one was telling me anything. And then his experience was a little different because I ended up kind of like seizure. I found out through my discharge paper that I was seizuring out, and me and him died on the birthing table. I'm gonna explain that in a second. So during the time of me being pregnant with him, um, I was going back and forth to the doctors, and no one explained nothing. But my blood pressure kept elevating. I ended up getting headaches. So my doctor told me to increase my medicine. Now at this time, he had gave me 90s, and he dropped it to 60s. It's my blood pressure medication. He told me to take 2 of the 60s. The whole time I wasn't paying attention. We all know pregnant with pregnant brain, you forget a lot of things. I was taking 2 90s. He did not, when I went to him and I told him, I'm taking 2 90s, he sent me home. I was having seizures. I was a walking seizures. I didn't have no signs of nothing. And I kept telling him I had headaches. I had headaches. I stayed with headaches. He told me nothing. So when I went back the next week, he immediately rushed me to cross retreat, and then I ended up having my son. Again, during this time and period, they still didn't tell me nothing. They didn't even tell my mom, who was there each and every time, who signed paperwork, me and her, to say, if you could not talk to me, you definitely could talk to her. Told her nothing. I had an emergency C-section. During the time of the emergency C-section with him, I was in there for an hour and 45 minutes. Still, again, my mom was sitting on the waiting room. No one told her anything. They rushed my son past her. Again, nothing. They told her nothing. So when I got my discharge papers, we realized that I was seizuring. I was seizuring out, and we both died on the table. They had to resuscitate both of us. So we're gonna fast forward to my third child. She is back there. She's down 5. Um, During a pregnancy with her, I had a doctor that actually listened and cared. She told me, she said, Miss Knight, I think you have sickle cell. I said, no, I don't. They tested me for all that. She said, no, did not. Can I test you for sickle cell? I have full-blown sickle cell C, which explains a lot. She explained preeclampsia to me. She explained what I'm going through and why I was going through everything. So it relates with each other. Sickle cell relates with preeclampsia, and I know everybody in the room knows that. So she taught me things to help me stay stress-free. Um, and I was able to have her on my choice, not because they pushed in my choice to have her at 37 weeks. I just got tired of her crying, and I'm not gonna lie. She's one of the biggest ones. I got tired of crying. So I scheduled my C-section. I was like, I'm going to have the C-section, but I could have carried her full term. Now my other 2, I could not carry full term. I had my son at 32. I had my oldest at 36 and a half. I could not, and I held her longest with no help. With my youngest, I was able to, if I chose to, go through the whole pregnancy, but I chose not to. So that is my experience. And I don't think I'm asking everyone to do is listen to us. Everybody's sign is not the same. Book knowledge, I get it, but my body said something totally different because the whole time my body was not connecting with the book knowledge. And I don't think we want to do is let someone hear us, understand that we matter as well, and our care matters. Thank you.
So, SherWanda, I just want to be one of the folks that tells you that I'm so thankful that you're here with us.
Thank you.
With everything that you experienced and all of the signs that were missed and all of the balls that were dropped, were there any sunny or positive moments during your birthing experiences? Did you have any support at all, whether at home, within community, with maybe a friend circle? Did you have any type of support outside of the providers that you were seeing?
So the support, it, I had support at home, but I
Mhm.
didn't have no outside support. I didn't have no one to run to explain because no one understood what I was trying to explain to them, what my body was going through. So the support, I want to say yes and I want to say no. Because my mama didn't know and understand what I was going through either. We tried, we went to different doctors, we tried everything, but oh, I'm sorry. My mother tried, but the support really wasn't there. I didn't, and then also the resources, it was there, but I didn't know nothing about them. So that was another thing that was a problem because resources was out there, um, but I didn't know anything about them, especially with my first.
If you could, and I know this may be difficult, if you could summarize your experiences in one single word, what would that word be?
Scary.
During the birthing experience that you had with your second, where both of you pretty much coded on the table and both of you had to be brought back, you said that your mother was in the waiting room and nobody was telling her anything. At what point did the knowledge of the situation, when was that brought to your attention? When did you find that out?
In my discharge papers, no one told me anything. Oh, I did leave out one thing too. Um, During my postpartum in the room after having my child, my second child, there was another issue. They left me in the room by myself. Mind you, I was bedpan. I couldn't move.
Mhm.
I was actually in and out, and I was there for about before I came through. I think I was there for 3 days before I came through. And when I did come through, I was sitting there and I told her I had to use the restroom. I clotted, I want to say the whole bedpan of blood. And I sat in for 2 hours. No one came to see me. But my pressure went down and they was, but no, this whole time my pressure was elevated. So when I called them, they should have came. No one came. So that was another thing that was scary as well, during the birth of my son, because no one came for 2 hours. But luckily, whatever happened, my blood pressure decreased and then it passed. So I thank God that, even though no one came in the room, I still was safe.
During postpartum, so the time after the 3 times that you've given birth, did any of your signs or symptoms, did any of them persist? I know that you mentioned the preeclampsia was pretty much an ongoing theme during your birthing experiences, but did any other signs or symptoms, persist during postpartum?
Um, I still have high blood pressure and I still catch headaches every now and then
How's your blood pressure being monitored and taken care of?
by me. I'm my own advocate. I make sure that and then I go to the doctors and I tell them now because I'm an advocate of my own.
Mhm.
I let them know, like, okay, this is working, this don't work. We need to try something different. So it's me now. Thank you.
Exactly. I just keep smiling at this woman because, like I said before, I am so glad that she's here. When we were having our patients as partners focus groups, I was a silent observer, basically camera off, microphone on mute. I wanted everyone to feel comfortable telling their stories and speaking their truths. And when SherWanda told her story, one, I was thankful that my camera was off because my face couldn't fix it to save my life. And when the focus group was over, I just remember feeling immense relief that she survived all that, but also extreme sadness that she had to go through any of that in the first place. Um, we're talking a lot about maternal mortality, and that's when the mothers are no longer here to tell their stories, to be there for their families, to be thriving and contributing to community. um, but in this instance, Shawanda, she encountered what's known as morbidity. And we call them, close calls or near misses. But at the end of the day, the way that we're trying to prevent instances of mortality, we need to be working just as hard, if not harder, to prevent morbidity, because we need to hear these types of stories. We need to realize where things can improve and ultimately how providers can do better by their patients. There's a quote that I've been seeing a lot on social media, and it says that if you don't care about maternal health, your hands should not be touching pregnant bodies. SherWanda, if there's a piece of advice that you could give to someone like me who's trying to conceive, or anyone else here in the room that has a loved one that is either trying, is currently pregnant, or at any stage postpartum, what piece of advice would you give to that person?
Well, for the people that's trying, I'll say never give up and make sure your voice is heard. And for those that's pregnant, make sure that they're listening. Make sure that they're understanding you as the person. Make sure they understand that you are a person and this is your body and it is important.
Oh, look, we're making good numbers and everything. So we'll open it up for any questions and or words of encouragement. Okay. Oh, okay, we have extra microphones.
Oh, sweet. Is it on? Hello. Oh, it is on. You rock, child. You really do. And I think I know you said the key was they listened. Was there something else? Because I think that it was more than just listening, right? Because I can listen to you, but I can be looking this direction. So what else was it about the provider that took you 3 times to get to? I know they listened, but what else did you get from them? Like, did you feel the genuineness of them? Like, what is the other characteristics that was about them?
She had a child with sickle cell and she cared. And it was the point that she was listening. She listened to my signs and not what her book knowledge said. Her child was going through the same exact signs that I was going through. So she listened to me. She actually opened her ears. She stopped what she was doing. She compared. And that was the important part because she understood. So it was the more of the connection of understanding what made it more impersonal. It was like a personal thing because she understood because she had a child just like me.
Keep telling your story because around the world, a lot of people going through just what you're going through because they being overlooked and not heard. So make a difference and keep telling your story and teach other women to tell their story.
I will. Thank you.
Thank you. Thank you again for sharing your story. And I just wanted to mention, in case folks don't know about it, the Hear Her campaign. So there are, that's from CDC, and they have patient stories, videos, print material that you can access, you can download, it's all free. That also shares remarkable stories just like yours.
I actually think I'm a part of it.
She's a part of the program. All right, I think we're good. Thank you for your time, everyone. Oh, hold on. Wait a minute. Someone's pointing. I know that's right.
giving us that extra push to stress the importance of being empowered to advocate for yourself. So thank you so much.
Thank you. Y'all just popping up.
I'll meet you in the middle so you don't have to keep running. I just wanted to say thank you so much. This summit saved the best for last, because hearing from you really just brought to life every single thing that's been talked about today. I thank you so much for sharing your story, and also for bringing your beautiful children with you today, a couple of them, not your son. But just thank you. And also just wanted to shout out Baltimore Healthy Start and the amazing work that you all do. That connection to community and that authenticity that you have, it's just something that can't be, bottled or packaged or whatever, but it's just real and it makes a difference. So thank you.
Thank you.
Thank you.